Every year, 9 million people around the world are estimated to be affected by tuberculosis. 1 million of them are believed to be children under the age of 15. No fast, simple screening test for the disease exists. The most commonly used method for diagnosing tuberculosis is to examine sputum under a microscope. However, this test, developed in the 19th century, only identifies half of those infected. It's particularly ineffective for patients co-infected with AIDS and for children. It's difficult for children to give a sputum sample in which the bacillus can be detected, so another option is to take an X-ray, but that requires qualified staff and resources, and even then it's not wholly reliable. Another problem is that many children develop an extrapulmonary form of tuberculosis.
The other main issue with regards to TB in children is it usually doesn't manifest in the same way it does with adults. So again, there's a whole other reason why it's more difficult. So even if you did have an adequate X-ray or an adequate sputum, the TB doesn't always show up. So again, you're continuing to kind of chase your tail with regards to TB diagnostics in children. That's clear throughout.
Other methods do exist. For children, diagnosis is based on a clinical examination that relies on 11 criteria. For HIV-positive patients, a negative sputum test is followed up by more advanced tests. And patients with a resistant form of TB must undergo drug sensitivity tests to determine which drugs can be used to treat them. However, overall, these methods are too unreliable and too complex to be used in countries with limited resources, where 95% of the patients live.